The fall school semester is well underway, and the Detroit Public Schools Community District is continuing to recover from pandemic-related losses. Finances, student enrollment, and attendance are among the primary focus areas for the district. I sat down for a wide-ranging conversation with Superintendent Dr. Nikolai Vitti on the grounds of the school at Marygrove. We talked about the successes, the challenges, and the priorities for the new school year. Let's talk about absenteeism. Talk about some of the things that you do or can do as a school district to try to intervene in that issue. I mean, I know people at very small schools, private schools, who will go and knock doors to try to get kids back into the school. What does that look like on the citywide scale of a DPS?
Yeah. Well, first is it comes down to just good data systems, and I just want to emphasize that we didn't have that 6 years ago. So just taking attendance regularly, the data system clearly shows who's at risk of being chronically absent, and that empowers the principal, the leadership team, counselors, attendance agents to engage in kids in a preemptive way, not waiting for the chronic absenteeism to occur. Then we have attendance agents at most of our schools that do the home visits. In addition to that, I think we're investing more in marketing to get the word out that attendance matters. I mean, just missing it one day a month leads to being identified as chronically absent. But beyond that, it's also building out the health hubs. And that is critical because it starts to address some of the reasons for the chronic absenteeism. So all of our schools have nurses. When students naturally feel sick, they go to the nurse. Because they talk to the nurse and the nurse calls home, parents less likely to pick up the child, which then leads them to stay in school but not miss the next day. And so we've seen an increase in attendance and a drop in chronic absence because of the nurses. But starting this year through private funding, we're building out health hubs in each of the feeder patterns throughout the city. So that means one high school or one K-8 will not only have a nurse there, but we will be doing outreach to families to offer mental health support for families and students, dental support, medical screenings and physicals, and just first review healthcare, along with eye support and as well. So there will be a family resource center at those health hubs too, where they can get help with evictions, with energy bills, and legal services. So we're trying to address the issues that lead to chronic absenteeism at the school site through these hubs. There'll be a referral system by employees for families, where families can just go there. They'll be open in the evening and the weekend, and we think that will curb some of the challenges to help families overcome the issues that naturally lead to chronic absenteeism.
Yeah. I want to talk a little about something that's going on at the state level. For years, we've been talking about the need to provide equitable funding to school districts, not equal funding. Right now, the way the formula works, everybody gets the same. There was a study about a decade ago in Lansing about the need to change that. The new majority in Lansing is saying, hey, we're going to try that out. What does that mean in a district like Detroit?
Yeah, it means everything. When I look at where we are as a district and the kind of improvement that we've made, systems and processes can improve, but we will hit a ceiling when you know about the average challenges that our children bring into school that are deeper, more severe, more at scale than, let's say, Birmingham or Southfield. And I commend the governor and the legislature. The gap has been narrowed, but we're still not at equal. So the actual per pupil funding is equal, but doesn't account for local funding. So every school districts in Michigan have to tax at 18 mills. And if that tax doesn't generate the minimum, which is at about $9,600 now, then the state makes up the difference to ensure that there is a floor to funding at $9,600. That's positive. But what ends up happening is if you generate more than $9,600, you get to keep that revenue. And that's part of local and state funding. And so that's how you see the discrepancy in per pupil funding with DPSED and mainly our neighborhood surrounding school districts. So the challenge with that is threefold. One, it affects teacher salaries. So it's not like DPSED doesn't want to pay our most veteran teachers more. These other districts just have more revenue to put into salaries. It also affects facilities. So the state doesn't allocate any dollars for facilities. So obviously if you're generating more revenue, you can put more money in facilities. So our buildings are on average 60 years old. We're using $700 million of COVID money to put major investment in facilities, which is going to make a difference, but that's going to be short-lived knowing the outstanding issues. And the third issue is just more dollars for wraparound services. So if the average student in Detroit is facing a more severe concentrated poverty, it's only natural that you need more resources to help the child and the family, whereas opposed to Southfield or Birmingham, those problems are minimum because of the higher socioeconomic background of the children. So with them having more state and local funding, they can spread those dollars out more than we can. And then we haven't even touched the issue of more special needs children in our district, or just transportation because of the square footage or the acreage of Detroit, and going east, west side, southwest, our costs of operations are just higher. So I'm hopeful that we can at least move to equal and then equitable. And everyone talks about federal funding. Well, DPSCD receives more federal funding. We should. The idea of federal funding is to...
It follows poverty.
Exactly. And special needs. So it was always about supplementing, not supplanting state funding. And over the years, large districts like ours, large urban districts, have had to use federal money to fill gaps that the state creates, which then doesn't allow us to use federal money the way it's intended, which is to build beyond state funding. The last point would be to create more flexibility with the at-risk money that we receive. That money is restricted, so it can't address teacher salaries, it can't address facilities. So even if the state isn't able to get to equal, then let us get flexibility with the at-risk money, so then we can address some of the issues that the inequity in state and local funding creates.
I mean, if you had to think about it just in maybe fantasy terms, what would be possible in Detroit if you had equitable funding? If they came up with a new number, 13,000, 14,000 a year, whatever, that Detroit would get as a compensation for the deep poverty, what kind of things would you be able to do that you can't do now?
Yeah, and you're right, that is the number. It's about
Is
13,
about 13,
yeah. Which is the wealthiest school district. So one, we would have teacher salaries that would be above our suburban school district counterparts. Not only do teachers deserve that, the ones there now, but future teachers deserve that, because you have to compensate them more to work in harder environments. That just makes sense. Yeah. And if we have that consistent flow of teachers and staffing, then we can address student achievement at a better rate. So that's one. The other thing that would be different is the quality of our facilities. With buildings being on average 60 years old, you really get frustrated as a superintendent when you have to close schools because it's too hot, or you have to close schools because the boiler breaks down. And that happens more than we know, and that we even talk about publicly. And this is 2023. Why in the world are we talking about a building not having heat in the winter? And it's not about, well, we're not investing the way we are. These buildings are old and the dollars aren't there to revamp an entire boiler system. So that would be a difference. And then the other difference would be stronger wraparound services for children. So we've already made significant investments in mental health support, nurses, but we want to go farther with expanded after-school programming and summer programming. And those are the things that would be different in DPSCD with equitable or equal funding.
Yeah. Last question. You've been here now, remind
Going
me.
into year 7.
Year 7. Okay.
The second longest
I was going to say, that's a long time for a Detroit superintendent, at least in modern terms. Give me an overall assessment of the time you've been here and what you, I guess, are looking forward to as you get longer and deeper into that tenure.
Yeah, I think, even the sharpest critic would say that we've gotten better over the last 7 years. We've improved enrollment, improved staffing. We were at 500, 400 teacher vacancies. To talk about 70 is a major improvement. Teacher compensation has dramatically improved. The quality of our principals has improved. Graduation rates now have improved. The financial status of the district has improved with, before I became superintendent, we would have almost 30 audit exceptions with millions of dollars in penalty. And now, 2 audits were completely clean. We have a reserve, actually funding on the side, which we're slowly investing in facilities. I think for me, It's about accelerating student achievement. I want to be not only the most improved large urban school district in the country, but I want to get closer to being the best large urban school district in the country. I want to get very intentional about succession management, not only for the school board, but for myself, for principal leaders in central office. So, we've turned around the district, but I want this to be sustainable. I don't, when my time is done, I don't want all of this to fall apart. And that's how a well-functioning organization operates, and that's what I believe DPSCD should look like.